Today, instead of handing out individual trophies, we all get to be awarded with the presence of some incredibly insightful and accomplished physicians. The talks today offer a reflection on the last few years, observation of our present, and a vision for the future.
To start us off, we are joined by Dr. Justin Bullock, a nephrology fellow at the University of Washington School of Medicine and a passionate medical educator. He self-identifies as a gay, Black, bipolar physician and researches how to minimize identity threats in the medical learning environment. His work draws upon his experience as a patient and his roles as a provider and healer.
For Dr. Bullock, medicine is a lifelong journey for providers and patients alike. He wants to make medicine a safe place where everyone can bring their authentic selves with them every day in the spirit of healing. Let's welcome Dr. Bullock as he presents I'm Just Trying to Survive. Doctor with bipolar disorder works to dismantle barriers.
Those same parts of ourselves that medical culture compels us to conceal are exactly those parts of ourselves that help us heal. My name is Justin Bullock, and I live and practice medicine with bipolar disorder. And today, I want to share with you some lessons that I've learned about what it means to truly heal using our humanity. I want to warn you that I'm going to talk about some heavy topics, including suicidality. And if at any point you need to step out or take a break, I encourage you to do so. Have you ever wondered what thoughts would be going through your mind when you're about to die? It's something that's always interested me. Would I know that I was about to die? Would I be happy with the things that I had done with my life? Would I be thinking about my family, my friends? I read these words as a first-year medical student to my medical school class at a day called Mental Illness Among Us, a day whose goal was to destigmatize mental illness. And as I spoke, I was in free fall under the wrath of a devastating depression. Suicidality is a key feature of my depressive episodes. I told my peers, even on your worst day, you are not alone. I'm suffering with you. But don't suffer alone. Get help. I was very lucky to go to a medical school where we had a program in which there was a psychiatrist and therapist who only saw medical students. And knowing my history with a suicide attempt in high school and multiple episodes of depression in the past, I made sure to sign up. Little did I know that the therapist that I would be connected with would change my life forever. That he would teach me more about healing for myself and for my patients than anyone else in my life. We were an unusual pair, the two of us. Me, a gay Black boy from Detroit, total nerd. For instance, I was recently walking into the hospital, and in the process, my book bag got caught in the door. And as I struggled to wiggle myself free, the papers that I was holding splay across the floor, my pager fell out of my holder and also went sliding as I scrambled on the ground to try and pick everything up. I wish I could say that something like this was unusual for me, but it wasn't. I'm a total nerd. And him, a white European with tattoos all over his body. He wore leather jackets and high-top gym shoes, walked with a bouncy gait. He was much cooler than I was. But we meshed. And pretty soon into doing therapy with this person, I began to question whether or not he was gay as well. And eventually I worked up the courage to ask him, and he disclosed to me, yes, that he was gay. For me, At that point in my life, having a gay therapist was magical. He was like my gay Sherpa. He wouldn't judge me. For example, while in medical school, I had a period where I lived a very lively life. I hooked up with a bunch of guys that I met on dating apps, and pretty soon I developed what I can only describe as a ring of fire in my rectum. And as may not be surprising, I soon found out that I had both gonorrhea and chlamydia. I immediately felt so much shame that I was fulfilling this gay stereotype, having tons of sex and being very impulsive, and I was being punished for it. I sat in therapy one day and I was disclosing this to my therapist and finished my story, awash in shame, and I look up at him and he's beaming, a giant smile on his face, and he says to me, "Aw, I remember the first time that I had chlamydia too." We both laughed. I rolled my eyes. In that moment, I was expecting him to lead with a lecture about safe sex and how I shouldn't be taking all these risks, but he didn't do that. Instead, what he did was he led with his humanity. He showed me, instead of telling me, he showed me that he had been exactly where I was and that he wasn't judging me. And it was moments like these that served as the foundation for a relationship that would one day save my life. As I got deeper into the depression that I mentioned in medical school, I resumed the antidepressants that I had taken in college. But this time, instead of getting better, I got worse. And my sleep went from 8 hours to 6 to 4 to where I was only sleeping 90 minutes at a time. I was becoming extremely angry and impulsive. And when I would get angry, I would do things like go for an all-out 22-mile run until I couldn't see or walk. I put in sharp objects through my skin. I drank to the point where I would pass out, wake up, and vomit. And I kept going to medical school. I was in what I now know to be a bipolar mixed episode, where the endless blizzard of depression meets the impulsive inferno of mania or hypomania, an often devastating and deadly combination. On October 13th, 2015, I woke up, I went for a run, I took my meds, I went to medical school, I went to therapy, I went home, and I attempted suicide. That night is burned into my memory. I had known for a while that I would attempt by overdose. As I attempted to write a suicide note to my family a few hours after taking the pills, soon my brain began to fog over. I could no longer form coherent sentences. The metabolic acidosis from these meds slowly crept up into my body, and I began to gasp for air, my respiratory system attempting to compensate for this acidosis that's in my blood. I lay down on the ground, gasping for air, crying. Music played in the background. Don't tell me if I'm dying, because I don't want to know. If I can't see the sun, maybe I should go. And somehow, through this darkness, a voice breaks through and touches me. "Justin, I want you to call me if you have an emergency." It was my therapist. You see, as I struggled in that moment of trying to figure out whether I wanted to live or die, it was that connection from this person who showed me that they were a human, that they were just like me, that proved to be strong enough to reach through me and touch me. So I picked up my phone, I called my therapist, and he didn't answer. Well, I'm clearly meant to die, I said to myself. A minute later, my therapist calls back. It's 2 a.m., and within 5 minutes, I'm unconscious, whisked away in an ambulance to the emergency room, urgently intubated in the ED as my therapist watched on. I survived. But contrary to what many people may think, I was not happy to survive. And in fact, my depression only got worse. I still sit awake at night in my hospital room, sobbing, in pain, suffering. And one night, in walks a nurse. And immediately I'm shocked, because this nurse is very clearly at least 30 weeks pregnant. And I was an impulsive, unpredictable, severely mentally ill patient. I had had thoughts about hurting other people so that I could hurt myself. She took my blood pressure, and before leaving, she looked over towards me and asked, "Would it be okay if I prayed for you?" I am not a religious person, and in fact, I've had a lot of trauma in my life around religion. But in that moment, I had nothing. "Sure, whatever," I say to her. She bows her head and begins her prayer, "Dear Heavenly Father." And in the process, her hand slowly drifts down to her belly as she begins to caress and soothe this young baby growing inside of her. And as she prayed for me, this person with this affliction who's suffering, I felt that she too was praying for her baby, that this little baby never suffer a pain like the one that I am experiencing. And in that moment, I too began to pray for this little baby, that this baby will live a full and happy life. And I actually felt hope for this baby. And this was the first time that I felt hope after attempting suicide. This was the first stair of my climb out of hell. And I think it's worth noting that this nurse and I, from my perspective, we didn't have very many things in common. I did not share her faith. And yet, somehow, her actions were profoundly healing. And I think the two things that I would say is, one, she asked permission, which I feel empowered me to make whatever decision I wanted. And two, she saw that I had taken my meds, I was going to therapy 3 times a week, I was running 60 miles a week, and despite all of that, I was still deathly ill. And in that moment, the only thing that she knew to give me was a small piece of her humanity. She finished her prayer and scurried out in tears. And that moment changed my life. Eventually, I left the hospital, and I was sitting in the office with my therapist, and he gave me a book. That book is called A Shining Affliction. Sorry, my slides. That book is called A Shining Affliction, and this book tells the story of a tormented boy named Ben and his therapist, Annie, and talks about how in the process of doing therapy, the two of their lives become intricately intertwined, sometimes in unexpected ways. And in the book, there's a message which says, the oldest meanings of the word affliction include a vision or spiritual sight that follows upon a time of darkness and torment. And in my therapist's handwriting, there are the words, Some afflictions are worth the pain of recovery. The first affliction that I had to deal with was this immense feeling of guilt for calling my therapist in that moment, for putting my life in his hands, for knowing that had he not answered, he would have lived the rest of his life with regret because he failed me. "But I called you back," he said to me, tears streaming down his face. He actually felt that I had given him an amazing gift by giving him the opportunity to try and save my life. And it took a really long time, but eventually we both felt happy that he had come through and fortunate. This healing process was not without more trauma. And 5 years later, as a resident, I attempted suicide for a third time. And in the process of being hospitalized and healing from that, I faced now as a physician an immense amount of bias and discrimination because I had this mental illness that I was so vocal and transparent about. And these are the same messages that get passed along to our kids. In this process, I was forced to talk with a psychiatrist who was not my normal psychiatrist. As I spoke about my relationship with my therapist, about how I actually loved this person, and I believe that he loved me, and about how seeing his tears as he cried allowed me to cry my own tears and feel my own pain and joy. As I spoke with the psychiatrist, they asked me a question. They said, "Have you and your therapist ever had an inappropriate relationship?" This psychiatrist somehow thought that it was possible that I could sit in an office directly across from my therapist every single week for 6 years talking about the most deep, intimate parts of my life, and the two of us not develop love for each other. It's because in medicine, we're taught to have this sterile distance between ourselves and our patients. Instead of learning how to productively leverage these parts of ourselves, we're taught to suppress them. Add on the intersectional identity of two gay men in an enclosed space with no one else watching, and people's stereotypes and biases abound. Eventually, I returned to residency, and towards the end of residency, I was in primary care clinic, and I had a telephone appointment with a young gentleman right about my age who also had bipolar disorder, who had had a prolonged hospitalization after a very serious suicide attempt. And I was the first provider to see him after being released from the hospital, well, via telephone. Eventually, he talks about his suicide attempt, and he says that he really regrets it, that it was stupid, that he doesn't know why he did it. And it was in this moment that I considered disclosing in a way that I hadn't done previously with any patient. And I asked myself, me being a person who's done a lot of therapy, was I disclosing for him? Would it be for me? Or would it be for both of us? I decided that it was for both of us, that it would clinically advance our care, potentially, and that it would help me. And so I told him that I too had bipolar disorder, that I too had attempted suicide, and I said, "I hear you say that you don't know why you did it and it was really stupid, and while I definitely don't want you to attempt suicide again, I would say, for me, every time that I've tried to hurt myself, it's been because I've been suffering very deeply and in so much pain." He agreed, and as we continued our conversation, I could just hear that he considered my thoughts just a bit differently. that as I spoke about different psychotropic medications, that he knew that I had been on many of them. And as I spoke, that I was speaking both from personal and professional expertise. As we finished this conversation, I asked if he had any more questions. Just one, he said. What was your name again? As we continued our relationship in an outpatient setting, we worked to try and help manage his very severe mental health symptoms in a system that was not providing this young, poor, very ill patient with the care that he needed without access to a psychiatrist. As we tried to titrate medications to help control his anxiety without increasing his risk for overdose, I felt that he trusted me. And one day, I got a message in my inbox which said, "I'm sorry to say, this patient has died. He died from overdose. He was suffering very deeply. I hope he's at peace now." And immediately, I jump into all these feelings of guilt that I prescribed something inappropriately, that I missed a clear red flag. And then I had to stop and take a step back. And I realized that, one, I had not made a prescribing error, that there weren't any red flags that I could obviously see, that this was a person who was afflicted with a very devastating health condition. And most importantly for me, I know for a fact that I was not judging this patient. I believe that he felt that I wouldn't judge him, that he felt seen by me, and most importantly, that I believe that I could be exactly where he was. And to me, that's healing in some way, even in a tragic outcome. And I think this is the message that I really want everyone to take from my talk, that I think we've all seen times in medicine where we reach the end of what medical science can provide. And it's exactly in those moments that leaning into our humanity and leveraging our humanity can help us provide so much more care. But I want to push everyone to not just wait until we reach the end, but to leverage those parts of ourselves throughout our relationships with patients. Those same parts of ourselves that medical culture convinces us to conceal are exactly those parts of ourselves that help us heal. Thank you. Okay. And actually, wait, I have one last thing that I want to say. My therapist is here in the audience. I promised him that I would not make him stand up and single him out, but I would hope that everyone could join me and stand up together and help applaud him for this person who saved my life so many times.